some of the listeners, they may be like first and second year med students. Could you just tell us, most people in medicine know what a hospitalist is, but maybe some of the students in the younger or in the
Sure.
earlier years, if you could just kind of tell us a little bit about what a hospitalist is.
Sure. So, yeah, the concept of hospital medicine got started about, I'd say, in the early 2000s. I mean, almost 20 years ago. And the way medicine used to be was that your primary care physician would see you both in the hospital when you were sick as well as in the office. But it just became, I'm not sure how the, kind of dichotomy or development started, what the really trigger was. But hospital medicine is strictly you are seeing inpatients in the hospital. So you do not work in an office setting. You practice internal medicine or family medicine of note. Most of the hospitalists are internal. Just to give you a heads up, internal medicine. But most it's just you do internal medicine in the hospital, and you do inpatient visits, discharges, admissions, consultations, and so you manage all that inpatient landscape. While your colleagues who do just outpatient primary care, they do the office setting. So really, it's just the split of the inpatient outpatient setting where you focus on the inpatients.
Nice, nice. Yeah, I think that's one thing maybe some people may confuse is like a primary, like the difference between a hospitalist and a primary care doctor. And it sounds like from what you're saying, a primary care doctor is exclusively, especially now, maybe in the old days, something was different, exclusively outpatient
Yeah, I
medicine.
mean, yeah, there are a few where I've practiced before I came to St. Louis and still here. There are a few primary care physicians who traditionally are older in their
Mhm.
60s because they came from that prior model where they still do out inpatient a few visits, maybe not on the weekends, but they do see as many of their inpatients. But I think they're just, it's very at this point in the next few years. I don't think you'll see a concierge doctor come to the hospital, but
Mhm.
I'd say most healthcare systems, at least 90-95% of the inpatient work is hospitalist and almost, those primary care physicians, those outpatient internal medicine, say about, in a few years, I'd say almost 100% of them will just do the clinic.
Gotcha, gotcha. And I think you already answered one of my other questions was so the training for the med students out there, it sounds like either you do an internal medicine residency or also maybe potentially family medicine residency could be a route as well. Is that correct?
Yeah, so I mean, I think the benefit of the internal medicine residency is that a bulk of your training is inpatient medicine
Mhm.
of the inpatient wards, at least half to 60%. Then you're dispersed with some consultation months, specialty, inpatient consultations, ID, cardiology, nephrology, you name it. But with the family medicine, I do have a lot of colleagues who are family medicine practitioners as well who are just, they do just as great of a job and it's just as qualified. And
Mhm.
I think it does help internal medicine residency to have those few extra inpatient months for experience. But if you are a family medicine doctor, there's no reason why you couldn't be a hospitalist as well.
Sure, sure. So it sounds like there's no fellowship or anything like that required, at least on the adult side. I've heard, is it true on the pediatric side, you have to do, if you want to be a pediatric hospitalist, you have to do like an extra fellowship or something like that?
I can't confirm it, but from everyone I've talked to, it is a little bit more difficult to get into peds hospitalists. Don't quote me, but I'm almost positive you have to do some type of fellowship, and usually it's 2 years for peds. But don't quote me. But that's what I've heard. I don't have a lot of colleagues who are in the pediatrics, but for hospitalist medicine, I'm very thankful that you can go straight into practice. I mean, some people do a 1 year research fellowship or administrative fellowship, but they're not widely offered enough to make it a prerequisite core to go into the hospitalist medicine field. I mean, there's just too many. I mean, I'd say if you have 12 people in a residency class, at least 30-40% will do hospitalist medicine, and there's not enough fellowships to cater to that. But there are some administrative research fellowships if you want to get involved with quality improvement. But I mean, I've done some quality improvement even without a fellowship. So it's
Sure.
definitely not a prerequisite to go in the field, but it definitely can add to your CV and that type of thing.
Nice, nice. So it's just a 3-year residency. That's nice. You can get out and out working
Oh,
in the world, which
absolutely.
is great. You're not like me stuck in residency forever, or
Ah, it definitely was one of the reasons I chose it as well.
yeah, yeah. No, I can understand that.